Hello, everyone. I'm Jana, and I'm with Dr. Bakhtari today, and we are thrilled to be here to talk to you about cataract surgery. I wanted to point out a few things as the moderator today. In the control panel, there's actually a questions box. So throughout the webinar, if you do have questions, feel free to chat us. And at the end, I will open those questions up to Dr. Bakhtari so he can answer those for us. So without further ado, I'd like to turn it over to Dr. Bakhtari for our webinar today.
Hey, good afternoon, everyone, and thank you for joining us for a cataract surgery webinar. I'm Pejman Bakhtari, and I'm one of the cornea specialists and cataract specialists in the Pacific Eye Institute, and so excited to have you all here. So we're going to go over the presentation about, like, generally speaking, cataract and just epidemiology in the United States. So, cataract is very common. Based on the categorization of the WHO, World Health Organization, cataract is the leading cause of blindness in the worldwide. And just like a million of cataract surgeries done on an annual basis in the United States, just like over 25 million Americans are estimated to have cataracts already that need surgery. So, and the June is the Cataract Awareness Month, so I'm glad we have this session just to inform you more about that. So what is cataract actually? Here you will see us like a very like a small view of the eyeball here, and just like any optical system needs some like a lens to provide converging power for incoming lights to focus it on like a membrane, like a retina in the back of the eye, as you can see here. This lens is a natural born lens here. That the upper one, the clear one, is the lens that we all have inside of the eye. We are born with that. And by time, we might get cataract, which is the brownish and a hazed lens you can see in the bottom. And this is the lens that has cataract. So cataract, by definition, is the opacity and haze in the lens. Inside of the lens, we have a lot of protein that they just change over time because of the degeneration, UV-induced chemical changes. And there are different types of cataract, if you heard about those, like a nuclear cataract, posterior subcapsular cataract, cortical cataract. Those are basically, a specification of the location of opacity inside of the lens. But anyway, when we have cataract, the media is not clear anymore, and the quality of vision could be affected. So I like that picture. It's like a cataract has very different symptoms. You see two pictures down there, eye with a cataract and the healthy eye. Just what it comes to first in mind is the color perception is a little bit different. You see a little bit, sounds like patient with a cataract is seeing everywhere with like a brownish, orange, yellowish filter, which is true. When cataracts start to form, we're going to see more like a brownish, yellowish color, and so having different color perception is actually one early signs of cataract. But anyway, so vision could be fog, blurry, cloudy. It could be more for near, more for far. Those are all signs of the cataract. Glare, halo, just like being more sensitive to the light, especially when the pupil is open. Most of the time, people start to realize that when they drive at night, everywhere is dark, and incoming light just will cause a lot of like a glare and halo. And double vision could be a sign of cataract. That's true. Just like most of the time, binocular double vision is a sign of like a muscle or nerves of the eyeball. But when we have a double vision in one eye, the sign is when even when you close the other eye, it still is double. That could be a sign of cataract too. It's just like one of the earliest signs of cataract is just you had eyeglasses for years and you have to change it more frequently now. That also could be a sign of cataract. It's like very different symptoms, very different, changes in the vision. That could be all because of the cataract. So and by numbers, how we do. Cataract has different causes. We might have like a congenital cataract, cataract due to trauma, cataract due to medication, especially corticosteroid. Those are just like a much more uncommon type of the cataract. But routine senile cataract that happen as a degeneration or change in our body, it's just like it's for everyone. We will get all cataract by some time if you survive enough. Let's say by age of 80, more than half of Americans, they already have cataract. And cataract is leading cause of vision loss in adult over 55-year-old. And just, that's just the awareness is because, it's a global problem. There are unfortunately many countries that they have visual loss and sometimes permanent visual loss because of the cataract, which was not timely treated. So it's a very common condition. And nowadays, our textbook, they're not categorizing cataract as a disease. It's something natural, happens to everyone. Next one, please. So cataract is not a medical emergency. That's true. Most of the time, cataract is there. You can do cataract surgery anytime that you like. So what is the best time of cataract surgery? The best time would be your choice. As a person, you want to see, okay, here is my vision. I like it. Still doesn't bother me. I'm driving good. I'm having great, just like a time reading, writing. That doesn't bother me. I want to just wait a little bit more. That's perfectly fine. And on the other side, you might say, okay, I'm not enjoying my vision the same as I used to. So this is the time to proceed with the cataract surgery. That's true. As a medical emergency, there is only very few, occasion that we consider cataract as an urgent problem. And those are the cataract that are just full, and just like it start to open up, raise the pressure inside of the eye. And those are like urgent cases. Otherwise, cataract surgery time-wise, it's basically whenever you like to do it. So talking about a cataract surgery, the cataract surgery is the most common surgery in the whole ophthalmology and in the whole human body. It's very common, as you can imagine. So over 3 million cases are done annually in the United States. And so just has a very high success rate. The number is just like a little bit, impressive. By generally speaking about everyone, just a 99.9% of the cataract surgery, they are very successful. And that's right, it's very common, and we are blessed to have a top-notch technology and just like a very good team, as you can see, that's right, it's like a very routine surgery here is in Pacific Eye Institute too. How we do the cataract surgery? Traditionally, cataract surgery was done in a very different ways. We used to just open the eye with an incision several millimeter, take the whole cataract out. But nowadays, it's a very small incision surgery. Like incisions are something around 1 to 2 millimeter, and overall we call those soft 3. Anything would be less than 3 millimeter. And we basically crack down the cataract to very small pieces. We'll aspirate it out of the eye. We'll keep the framework, and the cloudiness is gone, and then we can implant artificial lens inside of the eye. So, every single cataract surgery, more than 99% of the time, except for a very special occasions, we always need to implant a lens inside of the eye. If we don't, patient will not see anything, because, we are removing some, like a lens, which has like a converging capacity of the incoming light. If we're not replacing it, we don't have the focus of the light in the back of the eye in the retina, so we're not seeing anything. So talking about a cataract surgery, it's short, like a very successful, quick surgery, but still we always do one at a time. Except for, let's imagine like some, like a very underserved area on the planet that they have like a camp surgery, like a tracho with a mobile OR. They do both eye at the same time. It's like most of the time, if talking about an ASC hospital base, especially in this country, we always do one at a time. It's very safe, but still, it's a surgery. That's the best way, which is recommended. So talking about the lens implantation inside of the eye, it's a must at the time of cataract surgery, because the purpose is just doing a visual rehabilitation. So replacement with an intraocular lens, we have different options. So let's say we need to focus the pictures in the back of the eye so that we can see it. So the bottom line pictures, you will see 3 pictures. Like the first one is blurry in both far and near. The cell phone picture is in arm length, maybe 15 inches or so. And the other one, the little actual baby on the bed, is a little bit maybe further out. So it's both blurry. But after the surgery, far vision or intermediate vision in this picture looks like it's better, but the close-up is blurry still. Okay, so it tells me about, okay, so the near vision is a little bit different from far vision. That's true. Even without cataract surgery, we all have some condition which is called presbyopia around age 45 to 50, some people sooner, some people later on. So we need eyeglasses for close-up, and there is a physiologic reason for that. That's all for every human being. That's because the lens inside of the eye, it just changed the size and shapes based on some muscle works, which is called ciliary muscles, and we are losing that, power of the changing lens shape and dioptric power by time and age, actually in the kind of like a middle and young age. So traditionally, everyone after cataract surgery they need to wear glasses for close-up, reading or writing, anything in arm length or if 1 feet away. But look at the third picture. This shows after the cataract surgery, still someone is seeing clear, far and near at the same time, just like it's a lifestyle option or maybe just like a premium or upgrade lenses. And so, the lenses I'm just mentioning here, it's not because I'm using those lenses. Those are basically the top-notch lenses we have on this country and the whole world at this point. Just basically, the lens, the standard lens are monofocal. Like a monofocal lenses will give you one focal point. Usually we can just set it up for the far, and you need the glasses for close-up. That's the monofocal lens. But just how about having a clear range of vision? That's basically great, just like having clear vision from up close all the way to the back. So option for those lenses during the last few decades, there were a lot of options. You will see crystal lens here up in the right. Crystal lens was a lens that was supposed to being implanted in the eye and just moves a little bit forward, backward, and give you kind of like a far and near vision at the same time. I'm still seeing many people with crystal lens in the clinic almost every week. This is a lens which is not available anymore, and there is a reason for that. Just sounds like those lenses, they don't work the way they used to, because there's a little scar formation around the lens, and the movement of back and forth movement of the lens usually is minimal, almost close to zero after a few months. So what is the solution to the problem? It's a big problem. You can see from the size, number of the patient, quality of, many people, they like to have cataract surgery for better quality of life. They want to enjoy everything better. So the solution was multifocal lens for several years. Different name, different brands, but what you see here is like a Panoptix is one of the top-notch lenses we have. This is, so basically any multifocal lens, just to give you multifocality for far, near, intermediate, and whatever in between, they do have several concentric grooves on the lens. If you can see it here on the picture, maybe not very visible, sorry, but this is Panoptix, which is a kind of like a diffractive multifocal lens. That will give you the clear vision for far, near, intermediate, and like a kind of like a clear range of vision from close to far. And this has been, in the market in the US for almost last about 3 years. This is the newest option of the lens we have. And in the right, you will see another lens, which is called Vivity. There is a little difference between those lenses. Vivity is extended range of vision lens, which doesn't have those grooves, a little bit modified type of the groove. They have like a central, surface and a little bit peripheral surface. Not the same, but it's kind of like a simulation of the maybe bifocal or trifocal glasses. So what those kind of lens they actually do? Basically, if someone is interested to have a clear vision from up close to far, the Panoptix is one of the lenses that is very useful. Let me show it on the simulator. Here, in this picture, you will see a cell phone, which is holding up close at the arm length, and the desktop is intermediate vision, which is kind of like 1 or 2 feet away from you, and anything in the room far away is basically the far vision. So you had your cataract surgery done, and this is the monofocal vision. Look at the cell phone, it's all blur because it's a close-up. You need the reading glasses for that one. Look at the desktop, the laptop, and this one actually is giving you a little bit blurry vision, but better than the very close, which is a cell phone. And this is the like a 1 feet or so away, but everything at the far, it's perfectly clear. So if you would like to have a clear vision on monofocal lens, then you need to wear glasses to see the close, and for far, then you have to remove it, or you might have like a planar lens to see far and near at the same time, which will turn you to a bifocal. But look at a multifocal lens. It just brings everyone around at the clarity at the same time. Just like a cell phone is clear, laptop is clear, far away in the room, everything is clear. But that's the purpose of having multifocal lens. And basically, the options, why we have panoptics, and also the other option was the VVT lens, or just like, let's say, if you want to call it generally as a multifocal lens versus extended depths of focus lens. Talking about a multifocal lens, it's great just to have a clear vision, but there's a little small problem with those lenses. Since they have multiple grooves on the surface of the lens, they sometimes cause a little bit glare or halo around the incoming light, especially at night when the pupil is bigger. It's very small, it's minimal in the newer version of the lens. Look at that, if we can compare that. Yeah, it's just like if you see those little lights, just we always, even before the surgery, we have a little bit halo around that. But with the surgery, with the multifocal lens, we might see that's halo. But most of the time, that will go away very fast. Brain will adjust to the new optical system, and mostly it's not a problem. But for some people, if they really don't want that little glare, they can use the extended focus lens, and you can see it's less glare around the lights, especially like incoming light at night. But there is a price for that. The price is the extended focus lens. They will give you still good functional vision for close-up and intermediate, but not as good as panoptics or multifocal. Let's say, just to compare, yeah, so this is the multifocal or trifocal as we have it here. Those will give you the perfect vision for far and near at the same time, but a little bit glare or halo. This is the multifocal or trifocal lens. You see perfectly clear, you can read your book, and also the landscape looks great with a lot of detail. But if you look at the extended depths of focus, for far, you see perfectly fine. For close-up, you still are okay, but not as good as the multifocal ones.
I'm going to switch back to the presentation here, so 1 second.
So just to summarize, we have a different option for the lens that just everyone, we can just basically individually, make a decision about what's the best for the patient. It depends on the activity that mostly you like and your expectation and how makes you happier, basically. So I want to just give you a few words if you heard about Aura system. So let's say we're going to put a lens inside of the eye after cataract surgery. There are some measurements for this lens. That's true. We always do those measurements. And those measurements happen before the surgery, during one of the visits that you see your doctor before scheduling you for the surgery. And those are actually great, very precise. But there is one more option, Aura, or OptiWave refractive analysis. It's a machine which is mounted to the microscope. And good thing about the Aura is when we take the cataract out, everything is clear. We can do and redo the measurement right during the surgery in a few seconds, which is much more precise than the clinic, like a measurement that we do it before the surgery, but the cataract still is there. So Aura is always in the package of those premium lenses because we want the best refractive outcome, and no one would like a refractive surprise. So we just basically have to use every technology we have available to increase the accuracy of the measurement. But there are some few cases that we really need aura again. One of those are people who had a history of previous LASIK or PRK, RK, or any kind of refractive surgery. Then aura is actually great to redo the measurement and increase the accuracy. I just want to give a little bit of time at the end for any question, but sorry if I talk too fast because I just want to make sure everything is covered. So the frequently asked questions are just like is cataract surgery safe, as we discussed it in a few minutes ago? It's like let's say very safe. Like problems with the cataract are extremely rare. Like serious problems, less than 1 in thousands and thousands. So it's the safest and most successful surgery that someone might have. And cataract surgery mostly is not painful. It takes literally, it's like 10 minutes or sometimes even less than 10 minutes. 10 to 15 is a very good number. But just like the main problem with the cataract surgery is that we have a lead speculum, need to keep the eyelids open during the surgery. Like it's very like as a reflex, many people, they start to squeeze and they feel a little pressure when they do that. That's the main problem of like some mild discomfort that still might have it. But as long as you feel relaxed and use like a lie flat on the table, you should be very comfortable. There's a topical anesthesia for the cataract, and also at the same time, we'll give everyone some IV sedation just to make it a very, like an easier experience. What happened after cataract surgery? Like as you will go home same day, you will have a few drops to use. So you're basically back to your normal life, except for like a heavy lifting, do a very like a strenuous physical activity. So so basically you will have drop to use almost about a few weeks after the surgery, 2, 3 to 4 weeks, and also most of the time we tape a shield overnight just to protect the eye when you sleep. Yeah, just like insurances will cover all of the procedure. But the only thing is that those premium lenses sounds like, based on my understanding, none of the insurance, as far as I know, they cover those fully. So they basically they look at that something as a little bit fancy or like extra. And unfortunately, those premium lenses are not covered with the insurance. But everything else is fully covered. That's true. In terms of time for the surgery, we always check on you. We always measure the vision. And one thing to remember is that yes, you want to just look at your daily activity. You want to see how things going on in your personal life. And the other side is just we have some numbers. We have some standard like a visual chart that we see the numbers, and we always want to just check on those like numbers to see if vision has been decreased. Then we can basically like recommend cataract surgery. And some of those changes will happen very, very gradually.
Okay, so we're going to open up for questions now. I know some of you had asked questions throughout, so I just wanted to make sure you knew that there was a chat window. But in the meantime, I'm going to go ahead and read the questions that have come in so far, but feel free to ask questions right now. Let's see, after one eye surgical, can you read with your glass? Hang on, let me read this. So after you've had surgery on one eye, do you need a prescription for reading after surgery?
Yeah, it's like usually the best time to get the prescription for the eyeglasses is after you're all done with the surgery in both eyes. And usually we give it 1 month after the second eye, and this is the perfect time to get eyeglasses if you'd like to get one.
All right, and then what kind of follow-up appointments are required after cataract surgery?
Like a standard follow-up is 1 day after the surgery, 1 week after the surgery, and 1 month after the surgery. It's just like a routine, but the schedule might change a little bit for different reasons. But mostly it's the case, like a 1 day, 1 week, and 1 month.
Okay, perfect. And I'll give everybody another chance here to ask any questions. I had the 2 procedures done early in May and late May. My halos are quite large. Will it get any better?
Like a halo around, if you have a multifocal lens, just most of the time, the recommendation is wait for the halo adjustment. Usually, the good number is around like a 6 month. Most of the time, most of the people they do much better with the halo after 6 months. But sometimes, if you just really look for it, you may still find a little bit halo around the light, and that's the nature and the surface of those kind of lenses. But most of the time, like 99% of the time, based on the insert package of those lenses, after 6 months, people they ignore or then don't see the halo anymore.
Can cataract surgery correct astigmatism?
That's correct. Thank you for a great question. High astigmatism is basically a kind of like a refractive error that we have to wear glasses for that. And with a high astigmatism, it's hard just to tolerate the glasses. Let's say we always have some kind of premium lenses, which is called toric lens. We can use those kind of lens to correct astigmatism. On top of it, for a lower level of astigmatism, we can use some incision, which is called limbal relaxing incision, that we usually use those incision just to correct astigmatism less than 1 diopter.
If I don't mind wearing glasses, can the new lenses stimulate my current vision, or simulate rather my current vision?
If you really don't care about glasses, you're happy to wear the glasses, the monofocal regular lenses, they should work for you. Yeah, that's fine. And they have been in the like ophthalmology market for a long time. But this is a newer option. We have the multifocal lens nowadays. So both option opens, and that's the only your preference.
Perfect. Well, that was the last question. I will just leave it open for one more minute here, just in case anything else comes in. Don't want to cut anybody off. Somebody just made a comment that they're super happy with their Panoptics. It's really amazing. Looks like someone just wanted to mention that, so that's cool. But other than that, I think that's it today. We really appreciate you all attending. We will make this available, so check your email sometime in the next few days. We'll send out the recording. So if you missed it today or had a friend that missed it today, we'll make sure you can share that. And then also we hope to hear from you. Feel free to book a cataract evaluation. You can give us a call at 800-345-8979. But we really appreciate you attending today. Thank you, everyone. Have a wonderful weekend.